Hello and welcome back to another episode of Sonya Maya Psychology, or Ask the Clitician. I'm Dr. Sonya Maya, a sex therapist, psychologist, and Clitician. So if you want to learn more about psychology, sex, and relationships, hit that like, hit that subscribe, finger all the buttons, turn on bell notifications. I post every Sunday. Today I want to talk about a very popular topic online, which is it actually possible to increase your penis size once it's done growing? And is it possible to do it in a safe way? And the last one I talk about will be the one that I would recommend after talking to a doctor, of course, a medical doctor. So if you're into that, stay tuned. So this kind of goes without saying if you've been watching my content for a while, but most men are insecure about their penis size. Over half of men. And a lot of those men, they have average. And I've talked about this so many times, but 5 to 6 inches is about the average penis size, and that is when erect, okay? So a lot of the time when men are very insecure about their penis size, it's due to comparing themselves to porn stars, and society has reinforced the importance of size mattering for decades, for such a long time, and I've been trying to debunk that on my social media and really reminding people that size doesn't matter as much as reciprocity, caring for your partner's needs, etc., okay? But even when I use the hashtag of does size matter, it gets so many views. So this is a very popular topic. Men tend to believe that their size equals their masculinity or confidence or ability to please a woman or vulva owner, which is just not the case. And if you want to learn how to please somebody and be a good lover, then my channel is definitely somewhere that is a good start. Size anxiety actually can become quite clinical because there is a condition called penile dysmorphic disorder, PDD. And this is a form of body dysmorphic disorder where there is a belief that your penis is smaller than it is, and this leads to a lot of intrusive thoughts about your penis size, thinking that others are larger than you are, and this could lead to depression, anxiety, self-esteem issues, and then, of course, sexual difficulties like erectile issues, because being able to get an erection, that's one of the most common issues that men struggle with. And the last tip I'm going to be talking about can actually help you with erectile issues too, so keep that in mind. There's also, of course, small penis anxiety, or SPA. So this is anxiety about your penis being seen. You're like, I don't want anyone to see it. So this might come up in like locker rooms or something like that. And it might come up in dating and sex. It's like, ooh, I don't want someone to see my penis because then they're going to think that there's something wrong with me or something. And so a lot of people have this, they struggle with this even if they have an average or larger size, like I've said before. And like I've said before, there are just so many unrealistic expectations when it comes to porn, if that's been something you were exposed to from a young age. There's also big dick energy is talked about a lot in terms of like, oh, he has big dick energy, that kind of thing, which is more of like a personality trait than like an actual size issue from my understanding. But yeah, I think it really does stem from the belief that women, heterosexual women, care about size more than they actually do. And like I've said so many times, only 1/3 of women are actually able to have an orgasm, super pleasurable sex, from internal penetration. So as long as you know your way around the clitoris and making sure that you know how to stimulate her clitoris, which you're going to be doing with things that aren't your penis a lot of the time, then you're going to be in a lot more ahead, pun intended, than a lot of other individuals. So if penis size anxiety is getting in the way of your psychological well-being and self-esteem, it's really important to talk to a professional. Sex therapy can really come in handy here, or at least seeing a therapist who is sex positive, which can be hard to find. I recommend looking at the AASECT website type of thing. I'm currently waiting on getting AASECT certified, waiting for that to go through. I'm very excited about that. It's going to be just like another goal for me, and I'm really excited to continue my education associated with that. But anyways, enough about me. But it's important to talk to a medical professional. You don't want to give in to like certain devices or supplements that aren't evidence-based, which we'll get into in a moment. But in terms of who to see besides a psychologist, right, would be a urologist. So this is someone who evaluates penile health, erectile function, hormones, and anatomy. And there are some medical professionals who specialize even further in male sexual health and reproductive health. I've heard them be referred to as penis doctors by comedians, but obviously that's not like the full picture, right? It's called andrology if you are someone who specializes more in male sexual health, a lot of the time reproductive health. But when you see a urologist or an andrologist, they can help explain what's in the normal range, identify medical issues if present, rule things out, and also remind you of what things are evidence-based versus not, like, which is what I'm trying to do right now. So as I've already said, start with psychological treatment, see a psychologist, any type of therapist who is sex positive, who understands. It's better if they're ASEX certified or at least have a sex therapy certification. You can talk to a sex coach too, but given that I'm a psychologist and a sex therapist, I do recommend going the therapist route because it tends to be more evidence-based and more contained. Yeah, it can really help you work on your body image issues, your self-esteem concerns, erectile dysfunction not related to medical issues, anxiety reduction, relationship issues, navigating relationship dynamics more effectively, making sexual experiences more pleasure focused rather than performance focused is a huge one. That's something I talk about with my clients a lot. And this is often overlooked, but really important to keep in mind. So now let's get into the physical methods, okay? Some more effective than others, and some I would strongly suggest that you do not do. So there are these things called penile traction devices. They can lead to very small, we're talking like 2 centimeters small, okay? Increases in length. But the problem with these, there's many problems. One of the problems is that it takes hours every day for several months of stretching your peen out, okay? And like I said, the average gain is about 2 centimeters, which isn't a lot, but there are also a lot of possible side effects, such as numbness, bruising, high effort without much of a reward, frustration, I'm sure, and it doesn't work for everyone. So even though these exist and like have some outcome, wouldn't recommend. Number 2, penile injections for girth. Not for length, for girth. These are very high risk, not well researched, okay? There's actually been people who have died from doing this. My understanding is they use a similar type of injection as like lip injections, etc. It's cosmetic type of thing. But, if you were to do this, you want to make sure it's someone very credible, not just like someone you found on the internet or whatever, because that could be very, very dangerous. And also, keep in mind that complications with penile injections are often underreported, one could imagine for obvious reasons due to shame and embarrassment, etc. So you want to keep that in mind, and it can cause pain, swelling, deformity, infection, and you just don't want that to happen. And this type of thing really reminds me of something I talked about on TikTok a while ago. There was like this fake article, I hope it was fake, about people using bees to sting their peen, hoping it would get larger. I'm sure it's happened in history, but it's one of those things where it's like, please don't. So when I think about penile injections, it makes me think of like the bee strategy, because it's like maybe cosmetically, but like you're really, really risking your one-eyed monster. So wouldn't recommend. And also it's very expensive, super expensive, and requires repeat treatments, whereas you could be putting that money towards psychological well-being and other methods like we're about to get to very soon that would be more effective and actually give you the bang for your buck. Is that a pun? I guess it is. The next one I want to talk about would be penile enlargement surgery. The most common one is called a suspensory ligament incision. Feel free to look it up what that means. But this, again, often disappointing outcomes, and there's a high rate of dissatisfaction. Again, I would imagine that even with that, it's probably underreported for obvious reasons, and it's not usually recommended unless it's medically necessary. So you might be thinking, Dr. Sonya Maya, when would it actually be medically necessary? What I've heard urologists, doctors say, based on research, is when you have a micropenis or if you have a buried penis. What are those things? So I've talked about this before in many videos, but a micropenis is when you would stretch the penile length and it's about 2.6 inches. So that's 6.8 centimeters or less. It's very rare. Okay, but this is like a very, very small penis. And now I'm thinking about South Park's portrayal of the president, who we don't have to get into that. Don't like the president. But the president of the United States.
Your leadership is truly beyond anything we have ever had in this country. And you do not have a small penis.
Ah, thanks, gang.
Micropenis. Seemingly so. Anyways, there's also something called buried penis. So this is when the penis is typically normal or average in size, but it's hidden by surrounded tissue. So this can involve lower abdominal fat, which is why a lot of people say that if you lose weight, it can actually make your dick bigger. This is really just like optical illusion type shit, where it's like, it's going to look bigger because other parts of your area are slimmer, right? So buried penis can be caused by, a certain type of weight, gain, fat, etc. Also, your mons pubis area, that might actually cover up your penis area, especially if there's extra fat. Upper thigh fat, scrotal tissue, skin attachment issues. Can be born with buried penis, but it can also develop later, depending on, certain other medical issues. So it's something that sometimes when children have this, it actually resolves over time. But if you're an adult that has it, it would make sense for it to talk to a doctor about how to unbury your penis. Let's get to the grand finale. Let's talk about penis pumps. However, I do want to specify that air pumps are not as effective as water pumps, which I'm going to get into last because that was like, the thing I wanted to talk about the most. So air pumps, they create temporary erections. I feel like these are the ones that you see typically when you're like on Pornhub and like you just see like weird pumps or whatever, just like using the air. They're not super helpful because they only really give you like a temporary blood flow, and the results last like 20 minutes. So it's like, that's not very effective. Like, hold on, I need to do this real quick. And then you're probably going to like pressure yourself to like have an erection because you don't want to lose it from the pump. You know what I mean? So it's just not sustainable. There's also no permanent size changes. So now for the grand finale, what I wanted to talk about before, water pumps. These are the most evidence-based and actually effective, okay? For example, there is a brand called Bathmate. I do want to disclose that I have worked with Bathmate in the past with like short form content. This video is not going to be a promotional video for them. So I'm not going to like show you the pump, which I have in my closet. But I just want to tell you because it's really relevant for this video because it's the only one that I've found that myself and other experts recommend for increasing length and girth over time, as well as sexual health for men. So basically, they can help with length and girth. They can improve erectile blood flow over time. Results can improve over time, and it's actually healthy to get more blood flow to the penis. So this is actually really great, kind of similar to other things I've talked about for women when it comes to like masturbating more often, more blood flow to that area, using other types of sex toys, etc. It's kind of similar when it comes to water pumps, even though it's not for like pleasure in the moment, even though you can like add attachments to it like vibrators and whatnot to actually make the pump feel better. They're a lot more comfortable than air pumps. They have that vibration feature I just told you about, which can make it better and more effective. That's at least what my people have told me who've given me feedback for that, have bought the pumps for my link and everything. By the way, the link is below, but this isn't like an ad or whatever, but like it's there if you want to use it, whatever. The vibrators can also be used separately. So if you do get a Bathmate pump, you might want to get the bullet vibes that attach to it because they're some of my favorite bullet vibes ever for my own clitoris. When I've promoted it in the past, I've had followers tell me like, wow, this is actually really helpful. So that's really helpful to keep in mind. And if any client were to ever ask me about this issue and in terms of like wanting to improve their erectile function and wanting to increase their size, I would suggest Bathmate for sure. Water-based pumps are a lot more effective than alternatives, which is why I think it's so important to talk about. And I've also had followers say that it's improved their confidence in the bedroom, which makes sense, right? Because the blood flow is better, you're going to have more of that confidence. So yeah, if you want to check it out, the link is below. I do suggest you do your own research as well before deciding. Really important. Always do your own research and come up with that decision. And it might be a solid investment. The cool thing about it too is you can use it in the shower, but it doesn't like take super long, like 5 to 10 minutes pumping. So it's not like the whole like thing I said about before with like extending your penis. It's not like that. And it's not going to be as painful or painful at all, really. People haven't mentioned to me that there's pain. You can also go on their website and see other people give testimonials. And from what I've seen, it's been mostly positive. So one thing I want to mention too before I end the video is that pelvic floor matters as well. Like I've talked about many times, Kegels and pelvic floor exercises, they can help with erectile quality, endurance, and helps your penis feel firmer when erect, which might also help you feel more confident, especially if you are insecure about your size and performance. In closing, a lot of men really care about their penis size, even when average. But, if you're below average, doesn't make you a bad lover. There's so many other ways to improve your satisfaction. By the way, you can check out a video I made a few weeks ago about certain positions that are actually great for anyone, but especially if you have a smaller size, just if you want to have a little bit of tools in your tool belt. But there's no magic solution. Of course, there's things that you can do to improve your confidence and improve your girth and flow and everything. But it's really your choice if you want to do that. If this is impacting your life, talk to a doctor. Talk to a psychologist, therapist, sex therapist, talk to a urologist, andrologist, all of those things. Yeah, I hope you learned something new. I hope that hearing me talk about the evidence-based research behind penis size and stigma around sex helps you feel better about your penis, your body. There's so many different terms for penis. I almost called it a one-eyed monster. Again, your Johnson, have some love for it. It does a lot for you. So be grateful for what it does for you. And again, if you want to check out Bathmate, no pressure, but the link is below. Like and subscribe. Turn on bell notifications if you want to learn more about sex, relationships, and psychology. And like I always say, everyone make pleasurable decisions and decisions because you deserve it.